The introduction was written by Dr. Lynn Carmichael. When Dr. Carmichael died on June 19, 2009 at the age of 80, the former president of the Society of Teachers of Family Medicine, John J. Fry III, said that Dr. Carmichael is seen by many as the first to stake out the academic discipline of family medicine. In 1965, he wrote one of the first articles describing the discipline of family medicine, entitled Teaching Family Medicine, published by the Journal of American Medical Association. And on the same year, he established the first family medicine residency program at the University of Miami, serving as founding chair up until 1996. 2 years later, he became one of the founding members of the Society of Teachers of Family Medicine. He inspired, pushed, argued with colleagues into creating the movement to create the medical discipline of family medicine. So after almost a decade of trying to figure out what this medical discipline should be or ought to be, the textbook Family Medicine was published to tell everyone what the pioneers think it ought to be or what it will be. The first paragraph of the introduction says a lot. Dr. Carmichael says that there is a tendency by many medical specialists, general practitioners, nurses, politicians, policymakers, hospitals, colleges, medical institutions to use the term family medicine as synonymous with primary care, general practice, and family practice. Dr. Carmichael thinks this is a big problem and obstacle and operates to deny family medicine its rightful place in the medical curriculum. Meaning, during this time, family physicians are still having a hard time getting into hospitals and medical colleges and other academic institutions because many still don't know what it is, and many do not think that it is an actual academic medical discipline. To do this, he presents a table showing the difference between family practice, family specialist, and family medicine as a discipline. Family practice involves healthcare and medical practitioners, general practitioners working in the community, providing community and family care. The specialty involves the family physician, certified by this specialty organization. After doing appropriate training, family medicine, which is what the book is all about, involves different kinds of professionals, scholars, researchers, academicians, not just doctors, but maybe nurses, social workers, psychologists, therapists, counselors, public health and community scientists. And the concern is study, research, educate, and advance the field. This book is one of the first attempts to define the medical discipline. Why was this done? Because the 1950s, 1960s, and 1970s were periods of specialization, and the medical community are not prepared to accept a medical discipline that is too broad and too general and not well defined. So family medicine as a discipline has a very restricted definition to tell everyone that it's different from general medicine, internal medicine, pediatrics, public health, community science, psychology, family therapy, social work, and other well-defined fields. Family practice makes room for the general practitioners who are provided with continuing medical education and workshops, while the family specialist or the certified family physician are for those who have finished formal training, as well as the pioneering chairs and consultants such as Dr. Carmichael. Then Dr. Carmichael writes, "There is no better answer to those who ask the question, what is family medicine, than to respond, read the book of Dr. Medalie." And so we ask, how did they define it? How narrow is narrow? According to Dr. Carmichael, family medicine has as its concern not only the family as a unit, but the relationship between persons. Family medicine is different from general medicine, internal medicine, pediatrics, community health, public health, and other fields. It has a philosophical base that is separate, distinct, and often in opposition to the ethical basis of scientific medicine. So what does this all mean? This means that the pioneers, who are all general practitioners, argued, thought hard, debated, and tried to figure out what kind of modern medical discipline to define, advance, and improve general practice and primary care. And whatever it is, it has to be different from the existing medical disciplines. And during the 1960s and 1970s, most of them feel that they are different because of their personal working relationship with the patient and their families. And so the new discipline will concern itself with the family as a unit and relationships between people, between patients, family members, and their family physicians. And with this, it becomes well-defined and very different from all other medical disciplines. It is very personal, psychosocial, relationship, and context-driven. And then we can ask, why did they not include the community? It's not just family. The community is also a very unique feature of this field. Nowadays, in the 21st century, it's very hard to figure out, define, and study families. There's a wide variety and different kinds of families and households. There are other very influential social systems or groupings which influence illness and health, and it is a lot easier to figure out and study communities where patients and families live, where the family physician and family practitioners live and care for their patients and families. There are probably a variety of reasons, and while they were arguing and debating on what the discipline ought to be, I'm pretty sure community was discussed. But we know that during those times, 1950s, 1960s, 1970s, the family was still very cohesive and it was a very important social unit. They probably noticed that the family is becoming less cohesive, but I'm pretty sure nobody could have guessed the very confusing variety of families of the 21st century. So after the definition, Dr. Medalie presents us with the dimensions of this new academic medical discipline. Since the medical discipline is meant to advance and improve general practice and primary care services, it is therefore concerned with the various levels of practice. Unlike other medical disciplines, it is not concerned with just the individual cases or patients dealing with diseases. It is concerned with the individual, not just the case, but the whole person, the family. It looks at the individual patients in the context of their families. It manages them with a family orientation. It also looks at the family as a whole, and it also looks at communities where practices are located, individuals, families, and other groups inside the communities, as well as the community as a whole. Of course, based on their definition of family medicine, the discipline will be focused on the family as a unit and the family approach and orientation to care. And then he describes patterns of care, and he divides this into curative and preventive. The levels of practice and the patterns of care would form the practice gram. And then he adds the psychosocial dimension, the physical, emotional, and social, to form the three-dimensional phases of comprehensive care. Meaning, when it comes to family practitioners and family physicians, this is the scope of their practice. This is what they should be doing. These are also the areas which need studies, research, improvement, and advancement. Of course, the initial reaction of the medical community when presented with something like this is that it's too big, too broad, and too comprehensive. It cannot be done, practiced, researched, studied by just one specialist, professional, scientific field, or medical discipline. It is too obvious. Even the pioneers realized this, and so they introduced the idea of multiple professionals, disciplines, specialties, practitioners, academicians, researchers from various fields and disciplines. This would be the only way to deliver the comprehensive primary care services and the only way to advance and develop the new discipline of family medicine. After all this, the book proceeds to describe a medical discipline that's focused on the family. It talks about family as a system or the family unit, and of course, they have to start somewhere. The fairly well-developed ideas, concepts, models, approaches to family care, as well as research and studies on family from the 1950s to the early 1970s. So during these early decades, the general systems theory was very popular. It's being used in almost all fields and disciplines: the physical sciences, engineering, sociology, social work, psychology, ecology, environmental sciences, biology. And so the pioneers of family medicine, with their comprehensive approach to care, diseases, individual cases, whole persons, family units, and communities, also found general systems theory helpful and useful. And so this book describes the family as a system made up of individuals and subsystems, as well as being itself a subsystem of a larger social system, such as a community, and systems such as the whole person, made up of different organ systems, and the family, made up of different members of the family, and the community, made up of different individuals, groups, and families, are more than the sum of their parts, and therefore the system should be viewed and studied and considered as a whole unit, which leads to their idea of a medical discipline that's focused on the family system or the family as a unit. 80% of the book tries to describe and analyze a family system or family unit dealing with health-related problems. The book uses the most common approaches to family during the mid-20th century: structure and relationship between parts, husband, wife, mother, children, parental subunit, marital subunit, the eldest child, the youngest, grandparents, and others. Another way is to look at the family in terms of function, what it should be doing. Protect each family member, especially the kids, support, care, help each member grow and develop so that they can fulfill their tasks, roles, and function well as members of their family and their community. The family should also be able to function well as a unit in relation to the larger unit, which is the community. And during times of crises and problems, including medical or health-related problems, the family should be able to cope, adjust, make decisions, address, and solve the problems. This would usually involve good communication, decision-making, caring, loyalty, willingness to devote time and effort to the family and others. And finally, just like each person, the family as a whole grows, develops, and goes through life events. Just like individuals, the family would experience life problems and go through stages in life or developmental stages. The book then describes the big dream or the vision of the pioneers during the 1970s and early 1980s. Family physicians and family practitioners will be seeing all the members of the family. Instead of keeping records of individual cases, they would also have family charts and family records, and they would collect information about the family as a unit or the family system. In these charts, they would have a lot of information, tools, diagrams, and various ways of presenting and analyzing the information, including the tools that are already popular during the 1960s and 1970s. The family tree, a mapping of family relationships and conflicts, which the writers call psycho-figure, which was being popularized during those times by the structural family therapists and psychologists. A diagram depicting role perception, again from family psychologists and family therapists. For example, a member of the family can see herself as a student student, a daughter, and a sister. And the final diagram presented was the time flow family chart, which describes what has happened to each family member through time. For example, the mother could have a headache, dysmenorrhea, and irregular bleeding. The daughter was having an asthma attack in between the headache and the dysmenorrhea and was having poor grades. The father was having problems at work and lost his job while the daughter was having asthma. He then started having poor sleep and elevated blood pressure. During the time, the daughter was also having poor grades in school, and the mother was having her second bout of headaches. As we can see, we can get new ideas, form hypotheses, and define new problems just by looking at the time flow family chart. And with all these information, researchers, scholars, and scientists can analyze, do studies, develop hypotheses, create models, theories, in short, the things needed to develop and advance the new scientific medical discipline of family medicine. Of course, the writers of the book know that it's just a collection of variety of ideas, models, concepts, and approaches coming from different fields, especially social work, sociology, psychology, and family therapy. And they made a decent attempt to try to integrate all these. But in their minds, in 10 years, 20 years, 40 years of development, then the science and the discipline would be in a much better state. It would have matured enough to develop its own concepts, ideas, models, theories, and hypotheses. Of course,